We've got our beautiful, beautiful model today, who I think you've all met now from earlier on. And her main concern is she's not asking for volume here in her lips. She's asking for more definition. And especially from a profile, if we just have a look at her profile, she thinks that she needs more projection of her lip, especially in her lower lip, as you can see. If we manage to get a lateral view here, guys, that would be amazing. No, there we go. So she's asking for a bit more projection, especially here in this lower lip, and also volume. If we have a look at her thirds here in the lower third of her face, it does respect, you just have 1/3 to 2/3 going down here. So our aim will be to volumize both the upper and the lower lip and to give anterior projection, especially here at the GK point and of the lower lip. Now, I've marked these lines here because this is where I will add volume to the lip, because this is where it naturally has volume. Now, from here in the corners of the mouth, this lateral canthus here of the mouth, we would like to just add a tiny bit of volume here and invert it. So this is why first I've chosen to use RHA3, because I will need to add volume, but most importantly, I'll need to add some structure. And I've opted to use a cannula. And the reason for this, I often get asked, why do you prefer to use a cannula? Do you prefer to use a needle? And for me, it's not a question of preference. It's more of the indication. And here the indication is I'm treating a large area, and I really want to avert here the lateral canthus of her mouth. So for me, a cannula would be an easy approach, because I will use one entry point for both the upper and the lower lip, and I'm going to try and avert this lateral canthus here. If she was a younger patient with fuller lips, I would be a little bit against using a cannula, because I would be risking over-averting this lateral canthus here of the lip and giving her a little bit of a pout. So we're going to go ahead and start our treatment. So I'm just going to go ahead and disinfect. And my entry point will be here, just about 1 centimeter lateral to the oral commissure. And if I can just ask you to smile here for me. So we know that here the modiolus, that's usually where the artery gives off its branches there. And I'm sure you probably have a beautiful slide there, Patrick, to show us for that. So I'm going to be about 0.5 centimeter to 1 centimeter here, just lateral to the oral commissure here for my entry point. Okay. But yeah, you can see not just from an anterior view, the volume and the definition, and also the posture of the lateral canthus there on that side. And if we start moving her, if we can just get another look at the projection there compared to where we started, and also the lower lip. And now we'll just compare with the other side, the untreated side. And you see the posture there of the lateral canthus there, and also the difference in the volume there, both in the upper and the lower lip.
Do you inject sometimes the cupid bow, the vermilion border?
I can if I wanted to try and give her a little bit more anterior projection. I would just swap to a needle there, and I would literally just go about just 1/3 there into the philtrum column and retrograde a tiny bit of product. But I think that with just volumizing the lip from a lateral view here, you can see very, very nice projection there of her GK point.
Yeah.
If we can just swap to this treated side, thank you very much. You can see that there's this much better definition and projection there of the GK point, and all of her lower third just looks more in harmony and balance here.